Hey, this is part two of the video explaining basically what's been going on health wise with me. So, this part's going to be a little different because it's less about my actual health and more about decisions. So, really quick, so in the last video, I ended where I had a follow up appointment with my doctor to talk about next steps and what they were going to be. So, myself, my mom, and my daughter, we went to Rush Copley and we met with my doctor, Dr. Bloom. He's an amazing doctor. Got there, and basically, him and his RN had spoke with me and told me that they wanted me to have a lumpectomy and radiation. So they said because of my age, I should have radiation because that will sort of stop it from coming back. Maybe, big maybes in the air. But he said, this looks like it's curable. It looks like, there shouldn't be any complications, any problems. It doesn't look like it's moved anywhere. But I knew there were other options out there for me. I just didn't discuss them at the time. I just listened to what they wanted me to do. And then when I left from there, I got other opinions. Yeah. So, first of all, I jumped on Google, of course, and I started looking up everything I could learn about radiation and chemotherapy just in case that had to happen as well. So, after looking everything up, I saw the photos of what it looks like after a woman would have a lumpectomy and radiation, which, still when you're young, there's still a very high rate of it returning in the other breast. Also, radiation causes damage to your heart, which I'm overweight already. Honestly, I mean, I don't care about admitting that I'm on the spectrum that they show you or whatever on the chart that they show you medically. I'm morbidly obese. Now, I don't look at myself that way as being that huge, but honestly, I'm realistic as well. And I'm well over 200 pounds and I'm only 5 foot. So obviously, I'm a big girl. So I'm a big girl. My uncle had heart disease. My father had high blood pressure and diabetes. That both of those run pretty deep in my family. Also, you know, I didn't want to have one raisin looking boob and one regular boob. So I thought about, trying to find more information, which led me to my next bit that I went ahead and researched a little further, knowing people that have been through something similar. So I have an aunt that passed away from breast cancer many, many moons ago. So, this is long before some of the technology they have now. But also, I have another aunt that had it. And then I have an aunt who had it, and she decided to have a bilateral mastectomy. So they took both of her breasts off, and then she was, they put in tissue expanders, which are these things like, like a temporary implant, and then put they stretch your skin by putting a little bit of saline in at a time, so that your skin has time to grow. And she explained to me, I called her, she explained to me why she decided to go with that. Also, that it may be less, I may have less of a chance of it returning because, of course, it can't return in the other breast if I don't have it. You know, breast cancer is sort of like a mystery. So there's no way that they could say that I'll never have it again, even if I had both my breasts removed or if I had the one or whatever the case may be. But I knew I didn't want to risk heart disease through radiation. I knew I didn't want to risk that. So then I gave my girl, my friend, my long time childhood friend Jessica, a phone call. She is a cardiac surgeon. Um, I asked her, straight up, like, hey, have you ever, have you worked on people? How common is it for you to work on people who have heart damage due to radiation? And I didn't even tell her what was going on with me. She said, you know what? It's more common in breast cancer patients than anything else. Boom. So that already had told me what I needed to know, because I ain't got time for it. I have this going on, this going on, this going on. I want to just try and localize those things, get rid of them, and not add something to it, while trying to become healthy. I don't want to make a problem where there isn't one. Like I said, I'm black, I'm overweight, I have high cholesterol. All these things plus radiation would make it so that I possibly wouldn't even be a candidate for open heart surgery. I have to live. I have 4 children. Um, they're not, none of them, not even my oldest, is ready for me to go somewhere. They're all very immature still. Um, you know, so I have to be here, and I'm doing whatever it is I can to stay here. So then, um, Dr. Bloom's RN gave me a phone call, and she was talking about some of the things I had to do before my next appointment. And then I explained to her that, hey, I don't think I want to go the route of lumpectomy, because, just from what I'm hearing, I feel like maybe the bilateral mastectomy will be more better for me. She agreed, because she said that on the breast that had the large tumor on the tumor was actually attached to the base of my nipple. So I would have had to have one nipple removed anyway. And, who's walking around with one nipple, boob, one non? I mean, I get it. Some people are, and to each his own. Whatever it is you choose for you is what you choose for you. God bless you. It just wasn't for me. So I decided to go with the bilateral mastectomy, and that's what we ended up doing. But that was like, making a decision on what I wanted to do was heavy. It was weighing heavy on me. But what was weighing more heavy on me, unfortunately, was my job situation. I feel like, the people I work with, they did not have my back. They were not very caring at all. You know, my boss kept kind of like making sure I knew that my job was like dangling in the balance, or, that I won't be paid while I'm off work. And like I'm the sole, like I'm the not the only, but I am a very high contributor when it comes to my lifestyle. Um, like I said, I have all these children. We got bills. I have a house. I got, a car note. I have things that need to be paid that, aren't going to get, nobody's going to come out of nowhere. And, I don't have a rich family member that's going to say, don't worry, I'll take care of it for you while you're sick. That's not, the way that I have it. I don't have it that way. So I was very upset for quite a while, trying to figure out if I was going to be able to be paid from work, or if I was going to, whatever, because I did not qualify for FMLA because I had been at my job for 9 months. You have to be there at least 12 months to qualify for FMLA, even though FMLA, they don't get paid. So I wasn't mad at that. ADA for, temporary disability, they end up picking up my case, and, through different forms and papers they sent me, they let me know that as a salaried member of management, my position at work when I return depends on my manager and HR if they want to keep me there or if they don't. And I feel like my boss was not clear at any time on if he wanted to keep me there or not. And it just kind of, it was really stressing me out, especially given the fact that I have been, I've turned around the site completely. Like I am doing my job there and more. So once I got all of that settled and we talked about what we were going to do, um, my doctor's office sent me to the VNA where I filled out a different set of forms that they sent over to DHS office, and they approved me for Medicare because of my situation, which actually was a super blessing because, of course, you have to have insurance to do certain things. And even though, um, it just, I couldn't get other insurance places to pick me up because of my medical history. So that was a blessing. I mean, honestly, I don't know what I would have did if I was unable to get that. It was great. Especially because when I met with Dr. Bloom, he asked me some questions about different things or whatever. And he was like, know this, know that. Do you have this? Do you have that? And he asked if I had like chipped teeth or anything. And I honestly said, I have a tooth in the very back, bottom left, that is just, it's chipped, it's terrible, it's half a tooth, it has to go. So he then said that I would have to have that tooth pulled at least a week prior to surgery so that I did not cause an infection moving forward, because teeth germs, like anything you swallow, can cause an infection really easy when you're having a larger surgery. It's just going to cause a complication. So he wanted me to do that and get it out of the way first. And having that insurance made that possible for me. So that was great. Okay, so that's about where we're at for now. You guys are up to speed. I have to go in and have injections put in my right breast so that they can see all of the lymph nodes properly, because they're going to remove some of those in my right armpit when during the surgery. And then they'll be able to give me a better idea of if cancer has spread or not. Because if the cancer has not spread, there'll be nothing in the lymph nodes. If the cancer has spread, there will be cancerous cells on the lymph nodes as well. So I will update you guys here in a little bit when I get ready to do the first part, or the pre-surgery injections.